We have a wonderful session planned now, and everything we've talked about, I think, is going to be reflected in this panel. We're going to talk about Medicare for All and using it as a political theme. And the folks that are going to talk to you are going to be able to bring that right to the surface, and we'll be able to have some really good reflections of what we've been talking about the whole time. How many of you were in New York last year? Raise your hand. Wow. Yes. Wonderful. Well, one of your speakers today was in New York, and she had a heart-wrenching story as a mother. And so we're going to see what's happened in the last year. And how many of you are union folks in here? Oh, yeah. We got our union brother that's going to talk to you. And I know y'all have seen him if you get the emails like me. Wow. And then we have our veteran who's going to be able to pull all this together. He is, he's a pioneer in the Medicare for All, and he's going to bring it home. And let me just say, the round table discussions today were so good. We have some folks here. How many elected officials do we have in the room? Elected officials. Stand up. Elected officials. Okay. Elected officials. Very good. Okay. Where's Joe? Joe at the back table, is he gone? There was an elected councilman that just came because he supports Medicare for All. He was at our table. And then there were the DSA. And let me say on the DSA, there was so much diversity. There was us older guys and a lot of the young people. How many of you are DSA in the room? Yeah? Great. Wonderful. And it's so good to see all of you. And gosh, the labor leaders, I want to thank Mark for all he does. Well, see, I feel a little special. We get Mark in South Carolina a lot because he feels sorry for us and he comes down there. He's been fighting the battles with us, low density of union members, right to work, fire at will. If you don't know what that is, it's different from right to work, folks. Fire at will. So, and then we have great leaders like President Emeritus of Wisconsin who got Randy for us. David Newby, thank you for bringing our great speaker here with us today. And the other state leaders, like my state Fed president, I'm President Emeritus, Erin McKee from South Carolina. Our members support this, and we've been in, like Wisconsin, South Carolina has been in. We don't have the money, but we give what we can. And Erin, where are you? Stand up. Erin McKee, president of the AFL-CIO in South Carolina. Let me give you this challenge even before we begin. When you get through hearing what these panelists have to say, you need to go back if you're labor. And there's some great labor leaders in the room. Washington, there are more people here. But you as union members, you're the important folks. And you as members need to go back and say, listen, we've passed this resolution at the AFL-CIO convention a couple of times, a few times. Let's put our money where our mouth is. So we can start. Let me tell you where you can start. Tell them you want to join Labor Campaign for Single Payer. As soon as you get back, tell them, are we members? Why not? And they need to call Mark, need to get Mark on the agenda, and need to get affiliated with this organization that has been fighting this fight for so long, a long time before this, because he also was with the Labor Party. And we know that is an issue, one of the three issues they focused on. And then I want to challenge all of you, when you hear these candidates today, you go back. Now, we've got runoffs in South Carolina Tuesday. And Erin and I have been on the phone. This is the weekend before elections where our people get threatened, all kind of stuff comes out. And, we're telling our good candidates who stand up for Medicare for All, when you get through today, you need to be right. And you don't have to be in their state, but you need to be giving money to candidates. I don't care what little amount you want to give, to candidates that stand up for Medicare for All. So if you've got candidates running, go back and make you out a little list. After we get this runoff, I'm going to start doing some of this too. So make sure, one, let's put the money where our mouth is on Labor Campaign for Single Payer, on our candidates that are going to stand up for that and make it happen. So we want to make sure all of that gets done. So let's begin with our first candidate that is running in Nevada for Congressional District 4.
She ran already.
Oh, you've already run. Oh, my gosh. Amy, well, do y'all recognize Amy? You folks from New York? Stand up here, Amy. Yeah, but when we were in New York, didn't you speak in New York? Do y'all recognize Amy and her story? Oh, I'm so sorry. I didn't realize it was over, Amy. Congratulations. Yeah.
No.
I want to talk about it.
Yeah. All right. So Amy is going to talk about it, and guess what, y'all? She's taking on the establishment Democrats. I know that. That's what I've been reading. So let's turn it over now. And this is Amy, and Amy's last name is
Valella.
I'm sorry, folks. I know Amy because we met her last year, and we saw her at the AFL-CIO, and she's going to tell you about what she's done in the last year. So give her another big round of applause.
It feels really good to be back where it all started for me in the single-payer movement. A year and a half ago at that fateful Medicare for All rally here in New York City, I did not know where my road was going to take me. And I want to thank Ben. He was a big part of that. I started out coming to that event as just a grieving mother, and I didn't know where I wanted to go, and I was broken. And it was through the love of a lot of people sitting here today that and Nina Turner, I remember that my husband had met her. I'll tell you a little bit background story quickly. He had met her in the elevator, I did not know, and had told her the story of my daughter, Shalyn, and how I had to hold my daughter. She died a needless death because she could not provide proof of insurance. And I remember Nina Turner getting up, and she was saying, I didn't know he'd even spoken to her, and all of a sudden she starts telling the story of my daughter. The tears were coming down my face in that front seat. And I remember her saying, in this great country, no 22-year-old should be dying from a lack of health insurance. That is the truth. And I want to tell everyone in this room here that everyone should consider, or at least think about, running for something. Because it's going to take each and every one of us to infiltrate and get our message across and make sure that we have people who are elected who are in support of Medicare for All. I put this in real terms. When I was speaking to people, I was saying, we have 35,000 people a year dying from a lack of health insurance. And that's conservatively. That is 35,000 times the amount of pain that I have suffered since my daughter died. And since she died, next Thursday will be 3 years. That's 105,000 people that have died since she died, needlessly. And as I was on this kid, I went back to, I'm getting ahead of myself here. When I got back from this single-payer conference, I went out and I was able to get Dina Titus to be the first co-sponsor of HR 676 in Nevada. She did that after one rally. One. I had never thrown one before. I went back. No one was speaking of Medicare for All in Nevada at all. They have been successful in keeping that out of the mouths of Democrats. And now it is a thing. They used to only chant, this is what democracy looks like. Now it is fight, fight, fight. Healthcare is a human right. We have changed that conversation in a year. That I went to my congressman at the time, Reuben Kewin, and on Mother's Day weekend, confronted him about why. He's a member of the Progressive Caucus. Why are you not co-sponsoring Medicare for All? And I was telling him how they had to pull me away from my daughter's coffin because I knew it was the last time I'd ever see her or touch her again. And he looked at me and said, well, amongst other things, he was too busy fighting the ACA, he was too busy with North Korea, and I didn't have to be here today. I heard your story. I could have been out enjoying my weekend. So I decided that I was going to primary him. He eventually... He eventually had to step down because he was charged with sexual harassment. And then came in corporatist Democrats. One was an actual ex-lobbyist from Washington, D.C., saw an opportunity and swarmed in. And unfortunately, not only did he swarm in, but when they saw me making real traction, the Progressive Caucus backed him. The Black Caucus, the Latino Caucus, Joe Biden, and Kamala Harris. This is a man that, as I told my daughter's story, sat there and said, well, my grandmother died when I was 23, so I know what you're going through. And then he told the story of how he had 6-way bypass surgery. We have great health care. We just need to improve access and affordability. And that he had excellent care. And that the real problem was prescription drugs, which Big Pharma is a problem. But he failed to mention that his care was given to him while he was a congressman on congressional insurance, government insurance. And I sat back and I watched all this play out, and I watched also then, unfortunately, the unions get involved. And I'm telling you all this because we have a lot of work from the inside we need to do. We cannot just say, they're the Progressive Caucus, they're good, we don't have to worry about it. We cannot say, they're unions, they're good, we don't have to worry about it. The unions then swarmed in because they're scared that if you take away the health insurance, here I'm talking about Nevada specific, one of the largest ones out there is Culinary, and the AFL-CIO, all of them backed this candidate. One who was not going to support Medicare for all. We have to start working from the inside. We have to start working and pushing up on leadership of unions, pushing on the leadership that's in the Progressive Caucus. Every member of the Progressive Caucus should be co-sponsoring HR 676. And I would say, never think that your voice doesn't matter. A year and a half ago, I was just that grieving mother, crying. And I still cry, almost every day. But I stood up. I did change the conversation. No, I did not win that first race. I will run again. I'm not done, and you shouldn't be done. You can make a difference. You can make a difference. Stand up for what's right. Be bold. Speak truth. And go out and tell people what's happening. We have to speak up for the voiceless. There again, by next year, our next single-payer conference, another 35,000 people will have lost their lives due to lack of insurance. It's inhumane. And right now, we need to be on the right side of history and backing, like she said, back all the candidates. We need to be moving forward and helping support progressives. We have to find a way to get all the organizations to come together to be a stronger base. It can be done. We can win. This is the groundwork. Do not get discouraged with losses. I knew my odds were really long, but let me tell you what, every single one of those debates and forums in front of all of the Democrats, I had them shaking, and they were having to move left. So when it gets time for next time, they're already moved left. We're going to keep on moving left, keep on talking it, and go back and make a change. Thank you.
As far as I'm concerned, she's still a candidate, and if she were in South Carolina, you could run as a Labor Party candidate, because we're the only state that has a Labor Party line in the country. We have it. And, this is what we need to be saying everywhere to our members and getting that establishment. I want to tell you what, the candidate that has a runoff Tuesday in South Carolina, she's running again. Do you remember the congressman that stood up when Obama spoke and said, "You lie"? His name is Joe Wilson, and he's my congressman. Well, so today, and nobody's ever been able to defeat him or Spence before him, but today when I was calling Annabelle back, because she's calling me and Erin because they're attacking her over the weekend right before, this is what happens, and I said, "It happens, Annabelle, but here's her message. Hi, I'm Annabelle Robertson, and I'm running for Congressional District 2 in South Carolina. I want to repeal," how did she put this? "I want to repeal and replace You Lie, Joe Wilson." She is unabashedly not ashamed to be for Medicare for All, and she loves being a progressive. And it is the thing this year to be progressive, so be very clear about who is progressive. But she definitely is. And we have another progressive. He's someone that understands what it is to be a union member in the trenches, fighting every day. And I think it's a great honor. Thank you once again, David, for bringing him here for Wisconsin to talk to you, Randy Bryce.
Thank you. Thank you so much, everybody. It really is great to be here. And for you Minnesota people, yes, I'm from Wisconsin, and I know we've gone back and forth. I remember cheering for the Brewers when your Twins would come in the Kirby Puckett days. I remember all of that. And I'm very much aware of the direction that our two states have gone. One state has gone up using progressive values. The other has banana Republicans in charge, and we're going the opposite direction. But we're doing things to change that. In my healthcare story, it's not unique. And sadly, it's far too common. When I was discharged from the Army, I came back and I had 2 full-time jobs, but not one of them afforded any health care. During that time was when I was diagnosed with cancer. I had no way to cover the costs, and I survived the disease, and even proven them wrong when they said I wasn't going to have a son as a result of the surgery. But the financial burden was just insurmountable, and it made me go into bankruptcy. But too many people have to do that. Bankruptcy is the leading cause right now. Am I out of time already? Is that, like we heard enough. Thanks for coming and have a great day. There you go. But it took several years to crawl out of that hole, and I'm forever grateful to my ex-wife, my son Ben's mom, that we were able to put our son first and make sure that he was taken care of until I was able to get back on my feet. And I know my story resonates with countless other people because it's their story too. Soon after, I was given the opportunity to have an apprenticeship as an iron worker. Now, working on the iron, it's a tough job, but it also is what helped me to get out of debt and to be able to provide for my son. It also allowed us to have good health insurance and that was my ticket to the middle class. And now when I say that I had access to good health insurance, the iron workers are self-insured. And what we do is we pay an administrator out of our funds to turn down our members' claims. Think about it. And there was one day on the job site, our campaign is like 1 year and 3 days old today. And the last job I had, it was a few months before I decided to get in and was talking with the other guys on the job site. We were putting up a parking structure at the local VA. And we're like, what's up with this guy, Paul Ryan? He had gone around, he'd been elected without much competition for 20 years, and all of a sudden he's talking about repealing and replacing our health care. So I looked up and I was like, why don't we repeal and replace this guy? So we're halfway there, we got him repealed. But it's going to be a long fight. It's not over. November, we will replace him. It will be with a union iron worker that scared him away. So when I knew that I was going to throw my hat in the ring against Paul Ryan, I knew that the first policy I was going to back was Medicare for all. It's crazy not to have access to health insurance or to have access to health insurance, but it's too expensive for us to actually use. I mean, my mom, who's in our first video, has MS. I'm a cancer survivor. My dad has Alzheimer's. He's living in assisted living. So all these things, how directly they affect my family, they also affect my neighbors. And just the stories I've been hearing from people, while I'm out campaigning is heartbreaking. And when I tell people that Medicare for All is a central part of our campaign, they really get excited. Too many people struggle with getting good health care coverage. This is an issue that affects everyone. And some of the stories that I've heard have to do with, well, first of all, I have a cousin that gave me $100. She won't be alive at this time next year. She's dying from cancer and has kind of, that's her plan. She can't afford to live. I've heard from a lady who went to the pharmacy. She had 10 medications. Talking to the pharmacist, I can only afford 3. Which 3 should I take? This is far too common. This is the United States of America. And after they go and pass, they give $1.5 trillion to people that don't need $1.5 trillion. And then they're going to tell us they don't have enough for us. Wrong. Medicare for All, it just makes sense. That's why I'm so proud to race to be one of the 122 current co-sponsors of H.R. 676, which is an expanded and improved Medicare for All Act. Good health care coverage is more than just a political position. It's the right thing to do. It's a compassionate thing to do. And it's something that everybody is deserving of. Looking forward to fighting this fight with you. We already are. If you look at where this first started off, there were only a couple of people not too long ago that were in favor of Medicare for All. They're like, what a radical idea. No, it's not. Taking care of ourselves is not a radical idea. It's something that should have been done long ago. Speaking of union issues too, it's about we need people that are going to stand up for us, with us. Our campaign was the first to unionize, and reimbursement with health care is part of that. It's important. It's about walking the walk, not just talking the talk. So I'm looking forward to, depending on what side of the aisle you are, some people call me outspoken, others say I have a big mouth. Either way, when I'm elected to Congress and I get sworn in January, you can guarantee that we are going to get Medicare for All passed.
Wow. And, are these two great candidates? And, we've got to make sure that we go back, do this again, Amy, because she's not going away, and we're really looking forward to January, but next year this time we expect to be hearing Amy's plans about running again. And I don't know how many of you, but I grew up on the coast of South Carolina, and I grew up to Sam Cooke's songs, and when Cherise sang that song this morning, about a change is coming, many a time we danced on the piers in South Carolina to that song. And now we have a veteran who's been dancing the song for a long time. We have Minnesota, we got our Minnesota senator here, and he and I talked earlier, and I didn't realize who he was, and I know I've seen him at probably a lot of healthcare conferences. And I should have known by the bow tie. But let's welcome that veteran who's been dancing the dance, and we need to follow him. It's Minnesota State Senator John Marty.
Thank you very much. Mark told me I had 15 minutes to respond to Matt's thing. They said that and this. Well, I'll be 10 then. Okay. Oh, but somebody better have a watch to watch. Single payer, I'm going to first start with some of the things that Matt was presenting. Single payer, I always talk about, I wrote a whole book on this thing, and I use the word single payer very few times. Why? Most people know they love it or they hate it, but they don't know what it is. And really, even if you explain what it is, it's not that descriptive. I tell people maybe you should think of it the way if you buy a new car, I ask you, what'd you buy? Dealer financed. Well, what kind of car, though? Do you have finance? You're really insistent. It doesn't tell you much. And so I've really stayed away from it a lot because of that, though I've been using it more in recent months and years because there's so many more people talking about it, and they do get what it is, and therefore you have to use it some. But yeah, I was really pleased that Matt's survey says Minnesota Health Plan is a good name. When we put that, when we came up with that name, it was simply to say what we want is a single health plan that covers every Minnesotan for all their medical needs, birth to death, everything. And so, I mean, Minnesota's really good with creative names for things, but I mean, I think at the national level, Medicare for all, or whatever we want to call these things, make it simple and understandable and something that makes sense to people. We don't want somebody else's system. We want the best thing that we picked up from everybody around. Use simple terms and so on. I'm going to jump around here on these, but the first thing I was going to say about campaigning with this, I've been doing this for 32 years. I think of myself as one of the new legislators in Minnesota, but I guess I'm not anymore. But one of the things that you got to learn is statistics. You know, we can talk about health care. It's twice as expensive here as the average of other countries, far more than twice in a lot of countries with worse outcomes and so on. But statistics don't really win things. You got to use them, but stories matter. And I don't think I could do a better job than point to the two stories you just heard a few minutes ago. And with that, I've never met Amy. I wasn't at this conference last year. You know, my first thought was, she better run again. She better run again. Running against the establishment, running against the DCCC, running against them. Boy, do we need people who do that. And her story, I don't think there's anybody, I haven't heard it, I figured it out from what she was saying here today. But I don't think there's anybody who keeps a dry eye when they hear that. Not people. People who hear stories like that, it affects them. And it changes them. And it gives you the reason for doing it. And it should shame the people who aren't supporting it, who say they care about it. One of the PNHP docs a year ago or a couple months ago wrote a thing on how we got to use the word single payer instead of universal health care because all these fraud plans are calling universal. I'd say, no, you just have to say, well, what does universal mean? It means it covers everyone. Everyone. No exceptions, period. And the reality is some of these things, the Center for American Progress and other things and so on, they're not universal. So I don't care if they call it single payer or universal, it's not. And the point is to stick with that. And it does help to have people who are incredibly articulate, like Randy and Amy. It does help to have that. And they both picked not the easiest races to take on. But, you know, I happen to believe you win races you didn't think you were going to win. And that leads me to another point. One of the biggest arguments we have against single payer, our Minnesota Health Plan in Minnesota, we got 2/3 of the DFL, or the Democratic Farmer Labor members of our legislature. We're in the minority right now. 2/3 of them are co-authors. The 122 members in Congress who have signed on H.R. 676 and so on, a lot of them are, well, the reason they did was because advocates forced them to. And what else are they going to be for? Well, we want to keep defending the ACA because it's so much less bad. And it is less bad. But why aren't we for something? I wanted to talk to our former senator in Minnesota when he signed on to Bernie's bill last year, Al Franken, wonderful guy. He's not around anymore. But when he signed on to Bernie's bill, they had a news conference and he spoke at it and he had wild enthusiasm. You know what he said? He said, well, you know, my good friend Paul Wellstone used to support this, used to author this. And so maybe it's one of the things we ought to consider. That's wild enthusiasm. Well, why the wild enthusiasm? Well, he has to be for it because a lot of folks in Minnesota have been pressing him, saying, we got to do something. The ACA is not enough. We got to fix the problem. But why is he so cautious then? Because he's scared. One of the terms Matt talked about, socialism. He's scared of that. And my pitch to him, and I was going to talk with him about it, but he left office before I had the chance. The pitch was going to be, Al, when you supported the ACA 8 years ago, what did they call you? A socialist. I mean, look, you're a Democrat, they're going to call you a socialist no matter what you're for. Well, maybe they're going to fight harder to defeat you because you're in favor of something they really hate. Well, last time, I don't know how much they raised, maybe 15, 20 million to defeat him. They spent every penny of it. You think they're going to fight any harder? They're going to fight as hard as they can no matter what you're for. So this far out on a limb that these candidates feel they're going on when they say, I'm going to be in favor of single payer. I'm going way out on a limb. You got to support me here. What limb are they going out on? They're going to be attacked by those folks anyhow. And so you go out, and these 17 senators who have now done it, some of them are probably very strongly in favor of it. Some are kind of scared. They go out there and say, so you know, it's one of the things we really ought to consider, Medicare for all. And you know what happens? People in the audience, they applaud. And there are 3 candidates here, and I think every one of us would say, when people applaud, you smile and you say it louder. And you say it earlier in your speech next time. And you say it more forcefully. And instead of saying, it's one of the things we ought to support, you start saying, we got to get this stuff. And people really applaud. And you know, one of the things that does show, you know, who's the most popular politician in the country by about 5 or 10 percentage points? A guy named Bernie Sanders. He's not doing it by ducking on the tough issues. And you know, so you go out there and you start being for this stuff, we might start winning some elections. And the best thing I can say about educating the Democratic Congressional Campaign Committee, DFL-CIO, and some of those establishment groups about changing this is we got to have some of these candidates start winning. It's going to take some of the incumbents who now are in favor, who still win, and actually win by bigger margins. Then all of a sudden, hey, maybe we shouldn't be thinking this is some fringe thing anymore, because it's not fringe. People have been for that all along. I want to say a couple more things real quickly, and I don't know how my time is going. Just cut when it's time. I was going to say that analogies, helping make things understandable, works. One of the biggest things you will hear, and we're going to hear every one of these, and Matt mentioned some of them, and when you hear these things, you've got to respond. You've got to take on their issues. One of the ones they'll say, if you don't have co-pays or deductibles, people are going to go crazy. They're going to go buy hog wild and get every health care they can get. How are we going to pay for this thing? You know, they say, I've heard the analogy, oh, what would it be like if at a grocery store everything was free? People would be buying steaks for their dog. Well, you know, health care is not like food. We all want the health care we need. But we love our doctors, and we love our nurses. But we don't like to go visit them. You know, I got Tuesday morning, got a few hours off. I think I'll go get me another colonoscopy. It was so much fun. You guys like that story. Maybe people in your states do too. They'll get it. Because really, I mean, think about it. Who goes to extra health care because it's fun? So use the analogies, the things to help people understand it. I want to take one more big one quickly. I could take one more, but I got 2 minutes, so I'll tell you one more. One of the pitches I've been trying to make is that we should not talk about taxes. California, oh, we're going to have double our taxes and so on. And I can tell you of the 60-some co-authors of our Minnesota bill, that's the one thing they're worried about. They're going to come back and we're going to be not just raising taxes, we're going to be raising taxes off the roof. And when Vermont bailed on its proposal, whether it was single payer or not, when they did because Governor Shumlin couldn't find a way to raise $2 billion, Green Mountain Care folks were saying, but it'll save $2.5 billion elsewhere. Wall Street Journal, everybody else, oh, they couldn't find $2 billion for this cost-saving program. Well, let's stop. Let's think of the words we're using. Whose words are we using? Our Minnesota health plan, what are we funding it with? Premiums. What do we pay for health care? Premiums. Instead of premiums based on how sick you are and how old you are, we based ours based on ability to pay. If this bill passes, Minnesota Department of Revenue would collect the money, but it wouldn't go to the Minnesota state government. It would go to the Minnesota Health Fund, which funds only health care, which is the way we ought to do it. And in Washington, H.R. 676 my pitch to Keith and others is start talking about having it as a separate fund like the Social Security Trust Fund, because it makes sense that way. And pay for it with premiums. Because the idea we're going to switch our premiums from Geico or Blue Cross to Minnesota Health Plan or Medicare for All or Medicare, whatever we call it nationally, the idea of that is an understandable one to people, and people get those things. So talk about things in the way they get it. Out of time, so I'll just make a pitch. I wrote a book. I don't make a penny off it. I guarantee you that. You can download it online for free at mnhealthplan.org. And I just want to say there's nothing more important than having, one, candidates like this running, two, activists like this, the labor folks, just the plain old activists who come out and do these things. We're going to win this stuff, and we better, because if we're not mad at what Amy went through 35,000 times over, and several stories yesterday, we have so many Minnesota stories like that. Every one of you hears those stories. If we're not mad at that, we should be furious at our political system. Not furious enough to say, I'm staying home, but furious enough around to go and door knock for these candidates, furious enough to door knock to people just to talk about it, furious enough to change things. Thank you very much.